Hi, I'm Jared Thompson, and welcome to part 4. Let's talk about how pain can be managed in our healthcare system and some common misconceptions. There are a few different types of healthcare providers that give patients options to go see to get the pain relief that they need, all dependent on their access to care, insurance coverage, financial resources, preferences, their condition, and recommendations. There's a long list of providers that are trained to specialize in treating and educating about pain, including physical therapists, occupational therapists, chiropractors, psychologists, and more. Also on the team are specialists like cardiologists, neurologists, pediatricians, anesthesiologists, surgeons, and more. The list goes on and on. So, all of these medical professionals work together to provide their patients well rounded care, with the patient's primary care doctor to kind of oversee and coordinate their overall care. Many people believe that when they have pain that doesn't seem to go away on its own, they should go see their primary care doctor. While yes, they can make educated recommendations on how to manage the pain, their role is more focused on the big picture of your overall health, just to make sure that you don't have any serious medical conditions. Due to this, primary care doctors make referrals to other providers, like physical therapy, for example, to use movement based treatment to reduce pain. Um, Otherwise, they may also prescribe pain medications if the patient's pain is severe enough. Doesn't this seem like it's just one extra step that people need to take to receive the care that they actually need? What many people don't know is that in many states, they don't require a doctor's referral to be seen by another healthcare provider. So this means that if you have pain, you can go right to a chiropractor or right to a physical therapist or any other healthcare provider and see them first rather than skipping or rather than going to see your primary care doctor first and then going to physical therapy. Fortunately, every healthcare provider who you see first to treat your pain, whether it's physical therapy, occupational therapy, or others, they're all trained in screening for serious medical conditions on top of treating your pain. So, really, this subtracts the need for seeing multiple providers in most cases, which reduces the time, energy, and financial resources for the patient. The same concept applies for imaging. Imaging can be a great tool for us to look at those serious conditions you'd see your doctor for, but even if you have pain, the imaging results don't always show the root cause of the issue. In many cases, it can show results that the body tissues are injured when you really don't feel any symptoms uh, or any pain. This can obviously cause some fear around the results because let's say you feel like you broke your finger after slamming your finger shut in the door, and the x rays show that you don't. So, this is kind of contraindicating yourself and your thoughts around what you feel versus what's actually in the results of the imaging. For surgery and injections, they seem like they would be a quick fix for most patients. In reality, there is still a chance of still having pain afterwards, which could lead to a cycle of more and more surgeries, more and more injections, and unfortunately, pain. These treatments can help in many cases, but they aren't always the solution if the patient really may need other types of care, like managing their lifestyle factors through cognitive behavioral therapy, which I'll touch on in the final segment of this playlist. Overall, when there's more hoops to jump through with seeing multiple healthcare providers, having multiple types of treatment, multiple medications, or just poor coordination between healthcare providers, this can cause the pain rehab experience to become even harder and longer for the patient. This is why it is our goal as physical therapists to do what we can do to treat your pain while also keeping close contact with our patients and providers to make it as smooth as possible uh, in such a tough time as experiencing pain.